coxae, or the pelvic bone, also known as the hip bone. So these are the structures that you may have to know. This on top, this curved area is the iliac crest. Then you have this depression, which is called the iliac fossa. Then you have this, the pelvic bone is comprised of three bones fused together. You have the ilium, which is this area right here, the pubis, and the ischium, which is this bone right here. Now, this is the obturator foramen, which is this hole. Now, you have several spines. You have 4 spines that you need to know. And you have to figure out which side is anterior, which side is posterior, before you start naming them. Now, the way I think about it is this bumpy part here, this is the iliac tuberosity. So the iliac tuberosity is always going to be posterior, and the opposite side is anterior, okay? So this spine here is on top, so we're going to call it the anterior superior iliac spine, okay? This is the anterior inferior iliac spine because it's on the bottom. Then if you flip it to the other side, you have the posterior superior iliac spine. Then you have the posterior inferior iliac spine. And remember, the posterior side is always going to be on the same side as the iliac tuberosity. And this is the this is the greater sciatic notch. Then you have the ischial spine. Then you have the lesser sciatic notch. Then again you have the ischium. And then if you flip it to this side, you have the acetabulum, which is where the head of the femur goes into and forms the hip joint. And then you have the ischial tuberosity, which is this. Now, if you do have to know this, you have the superior ramus of the pubis, which is this portion right here. If you imagine a line right in the middle, this portion is going to be the inferior ramus of the pubis, and this portion is the ramus of the ischium, or ischial ramus. Okay, so this is the ischium, and this is the ischial ramus, and this is the inferior ramus of the pubis. Let me see, did I miss anything? Keep in mind when you place this hip on yourself to figure out if it's right or left, the acetabulum has to be facing laterally. So this would be my left hip, right? Because if I put it on my right, it doesn't fit properly. Does that make sense? Okay. And so this is it. Again, this is the ischial tuberosity. This is the acetabulum. This is the anterior superior iliac spine. This is the anterior inferior iliac spine. Then in the back you have the posterior superior iliac spine, posterior inferior iliac spine. And the rest we already went over, so we don't have to do it again. That's it. This concludes this video. Thank you.